Hello everyone, this is Muhammad Yasin, a fifth year medical student from Makerere University. Today we are going to discuss about linkage to the HIV services. In this topic we are going to discuss about barriers in HIV services, different types of linkages to the HIV services. It could be intra-facility linkage, or it could be inter-facility linkage, or it could be community linkage services. Let's say a client came to your office and he is a HIV diagnosed, newly diagnosed HIV client, and he want to get connected to the HIV services. In that case, a doctor should link the patient to the HIV services where they are offering. So that means connecting from one point of care to the another point of care. So that is called as a linkage of HIV services. So when linking a client to the HIV services, we'll find some challenges when linking the patient. It could be client factors or any social or cultural factors, or it could be any structural or any legal issues. It could be economical factors which are restricting the patient in getting the HIV services. So in client factors, the patient can say you that he is healthy and doesn't want any HIV services or linkages to the HIV. Or in some cases, like if the patient is depressed and doesn't want any HIV support or any HIV care. In some cases, the client can have lack of family support or any social support that is stopping from getting HIV services, or any fear of disclosure or any fear of discrimination can also become a barrier to HIV linkages and services. So for these patients, we need to counsel them and make them understand better about HIV care and services in order to proceed in linkage of HIV services. Some clients will give you a reason for not getting connected to the HIV services. They say that they doesn't have money to get transported to the HIV clinic, or they will say that the clinic is very far away from their home to visit regularly. Another barrier in this category is health system barriers. In this, the patient can get the poor referrals from the clinic, or not getting connected well to the HIV services, or it can be unfriendly behavior from the doctor or any healthcare worker towards the patient, or showing any biased behavior towards the patient that could also become a barrier in getting to HIV services. Sometimes the clients, when come to the HIV services, will be waiting for long time in getting connected to the HIV services. So these are some of the barriers that we discussed in this topic, which are stopping the patient from getting connected to the HIV services. So now let's discuss the different types of linkages in HIV services. Let's say a patient came to you in a clinic and he wants to get connected to the HIV services. So for example, let's say in your hospital you're offering HIV services also. So you can connect the patient to the HIV services within the same facility. This is called intra-facility linkage. So you can link the patient on the same day of referring the patient to the HIV services, or within 7 days. How do you link the patient within the same facility? There are 3 ways in which you give the counseling to the patient. After giving the counseling, you can link the patient to the HIV clinic, then enroll the patient in the HIV clinic. So in post-test counseling, you need to provide the accurate results to the patient. After providing them, you need to provide the information about the care that is available in the facility, and then you can discuss about the next plan and the next treatment care with the patient. And you can also discuss the early treatment advantages and also the delayed treatment disadvantages. So when you're counseling the patient, you need to also identify the barriers that are stopping the patient from getting connected to the HIV services. Bringing this all into the action, involve the patient in decision making when providing HIV care and services. So when you're done with decision making, fill the client cards and referral notes, and then also fill HIV referral forms. After which, introduce and hand over the patient to the linkage facilitator. In case if the linkage is not possible on the same day, you need to give an appointment to the patient and ensure that the patient is linked to the HIV clinic in 7 days. Make sure the linkage facilitator links the patient to the HIV clinic with referral form and hands over the patient to the responsible staff member in HIV clinic, who will register the patient for pre-auth registration and linkage to the HIV services. Following the registration, complete the enrollment section of register if the client is enrolled. Then open the HIV card or HIV file for a patient. The next step is to offer counseling and conducting baseline investigations. In case the patient is ready to start ART, initiate ART and give proper adherence counseling. You need to coordinate integrated HIV care to the patient if required, in cases like if the patient has any co-infections. And lastly, discuss with the patient and give an appointment to the patient. This brings us to the end of intra-facility linkage. What if the hospital doesn't have any HIV services offering in their facility? Then you will have to link the patient from one facility to other facility. This is called intra-facility linkage. When you're referring this patient from one facility to other facility, you need to have a track on that patient to ensure that if the patient is receiving HIV services in other facility or not within 14 days. So this can be done by using the follow-up or tracking schedule. How do you use this tracking schedule? On day 1, when the patient is diagnosed with HIV and was referred to the HIV clinic, linkage facilitator documents the client contacts and also obtain the consent for home visits, thus connecting this patient to the community health worker. Then the next follow-up is after a week, in which the linkage facilitator calls the client or contacts the health facility if the client reached the facility or not. In case the client reached the facility, document it as the complete linkage. What if the client did not reach to the facility even after 14 days? What are you going to do? You need to send the community health worker to his home to inquire why the client is not coming to the facility. Then address the patient's challenges and the reasons why the patient is not coming to the facility. Then you can call a client or a contact to the facility to know if the patient reached the facility or not. If the patient did not reach to the facility, you can document as a lost. Regarding community facility linkage, you need to connect the client from community to the facility in order to provide HIV care, treatment and support services. This should be done within 14 days. On the day 1 of follow-up, when the patient is diagnosed with HIV and was referring to the facility, the patient should have the triplicate referral form. And this triplicate referral form should be delivered to the facility where the patient is referred. In the week 1 of follow-up, the community health worker visits the patient's home and inquire why the patient is not coming to the facility. And after knowing the reasons, you give the new appointment to the patient and encourage the patient to come to the facility. After that, the community health worker documents the outcomes of the visit and give the information to the community health team. As we followed this patient in interfacility linkage, we also did same in the community facility linkage also. So in the week 2 of follow-up, the community health worker makes the final visit to the client's home and discuss the reasons why the patient is not coming to the facility. If the patient is willing to come to the facility, give him an appointment and encourage him to come to the facility. Otherwise, document the outcome as the patient is not ready, if the patient is refusing to take the treatment, or relocated. In this video, we discussed about the barriers that are affecting the linkages and different types of linkages and also the follow-ups. What if the patient is not linked to the services? Like there are many disadvantages, like it increases the transmission rate, it increases the mortality rate, and also becomes a burden on healthcare system and also the society. So it is essential to connect the patients to the HIV services. Thank you for watching the video.
If you enjoyed this video, please give it a thumbs up and share it with your friends. You can also subscribe to our channel for more great content. And don't forget to follow us on Instagram, Twitter, Facebook and TikTok.